Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. COVID-19. So COVID-19 is as per the CORAD's 5 observation, and this observation is seen in the HRCT. Then is the bilateral peripheral ground glass opacities, bilateral peripheral ground glass opacities. Now this CORAD's, it is not used to determine the severity, but it is used to detect the presence. When you look at the CORAD-6, the CORAD-6, it is suggestive of RT-PCR. CORAD-6 is RT-PCR positivity, and then comes the mucormycosis. The mucormycosis, especially in case of the diabetes and also the presence of the steroid use. Then comes the black fungus. The black fungus is due to the necrosis. The black fungus is present due to the necrosis. There is also presence of the black turbinate sign. The black turbinate sign, it is a devitalized mucosa. It is a devitalized mucosa, and it appears on the contrast enhanced. It appears on the contrast enhanced MR imaging as a contiguous foci, of the non-enhancing tissue, and it leads to the black turbinate sign, that is BTS. To learn and grow daily like this, please do subscribe.